the exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com.
Good evening friends, welcome back to BMC Global Live Hilal Health World, nothing but lifestyle. I am Anupama Menon. Health is a relationship between you and your body. If that relationship is smooth sailing, everything else falls into place. But the reality of life is, we may all encounter some health issue or the other at some point or the other in our lives. It's unavoidable and sometimes it catches us off guard. One such problem is frozen shoulder, which affects a lot of people of all ages, and those who have experienced it know very well that it can be a very painful condition and it can actually prevent the patient from leading a normal lifestyle. So I'm sure many of you would like to know more about frozen shoulder and its treatment options. To discuss more about this, today we are joined by Dr Imith Kodungookaran, specialist orthopedic surgeon at Hilal Hospital, Salmabad. He comes with a wealth of experience of over 8 years in the field of orthopedics. Welcome to the show, doctor, and thank you for joining us. So doctor, can we begin by describing what exactly is frozen shoulder? How would you define it in medical terms?
Frozen shoulder is a fairly common, painful, debilitating condition, as you said, which affect our shoulder joint. By definition, frozen shoulder is a condition of varying severity characterized by gradual development of global limitation of both active and passive range of motion, where radiographic evidence other than osteopenia is absent. I know this is a bit difficult with
medical terms, yes.
Yeah, difficult to understand this definition. I will explain more about frozen shoulder with the help of this definition itself. So first of all, it is a condition of varying severity. That means if frozen shoulder usually is a self-limiting condition. That means patient recovers by its own within around 2 or 3 years time. That's a usual scenario that we see clinically. So, but during this course, intensity of pain and the stiffness, the severity of stiffness is not constant, it varies. So that's what it means by it's a condition of varying severity characterized by gradual development of, that means the onset and progression of frozen shoulder requires few weeks to months, gradual development of global limitation of movement. That means all movements of shoulder joint become stiff in this condition. However, some movements like elevation through the side, for example, this is the elevation through the side and external rotation movement of the shoulder. So these two movements are more badly affected than other movements, but still almost all movements of the shoulder joint become stiff. That's what it means by global limitation of movement. And there will be the next part of the definition, there will be limitation of both active and passive range of motion. So active movement is movements that is carried out by active contraction of our own muscles. For example, I am actively lifting my right shoulder right now. So this is done by the active contraction of my own muscles. In passive movement, the movement is carried out by the force from an external source. For example, I am lifting the right shoulder with the help of force from the left hand. So this is passive movement. As in case of frozen shoulder, because of the fibrosis, both active and passive range of movement will be equally affected. So this is a hallmark clinical sign that we get in frozen shoulder, unlike in many other conditions like inflammation or tear of injury to the muscles inside the shoulder joint, where only active movement is restricted. In case of frozen shoulder, both these movements will be restricted. Now, last part of the definition, radiographic evidence other than osteopenia are absent. So radiographic evidence means X-ray finding. There is no specific X-ray finding for frozen shoulder, other than in some cases because the patient is not moving the side for a very long time. We can see the bone mass, the quality of the bone or density of the bone will be little less compared to the other side. So this is the only finding that we get in X-ray in case of frozen shoulder. So this is the basics of frozen shoulder as per the definition. Now to avoid confusion among viewers, this frozen shoulder have many other names. For example, older name for frozen shoulder is periarthritis shoulder, and a newer term for frozen shoulder is adhesive capsulitis. So we doctors and physiotherapists use these all names for calling the same condition only. So don't get confused if we call this condition as adhesive capsulitis. Do not think that it is the same as frozen shoulder.
Okay. So basically it severely restricts your movement, any kind of movement, it's severely restricted. And you said the normal time period is 2 to 3 years, and during this period it can fluctuate. The intensity of the pain and your flexibility and stiffness can fluctuate. So who are more at risk? I mean, is it the elderly people or are sports person more prone to getting this? Which age group is more prone to getting frozen shoulder?
In general population, the risk of getting frozen shoulder is around 2 to 5% and all.
That's very less.
Less only. Okay. The age group that is affected mostly is between 40 to 60 years. 40 to 60 years.
And elderly.
Yeah. And getting frozen shoulder below a fourth decade is very rare.
Okay. So not even 40. In the case of sports persons.
No.
So this cannot happen due to injury, right?
No, it can happen due to injury also. That we will discuss as the causes. Okay. No problem. Now. 40 to 60 years is the more prone age group, and females have a more tendency to develop frozen shoulder than males. And regarding the side of involvement, mostly non-dominant side have a more tendency to develop frozen shoulder than the dominant side. Suppose you are a right-handed person, your left shoulder have more tendency to develop frozen shoulder than right side. And bilateral involvement, that means involvement of both shoulders, this can happen in up to 40% of the patients. But luckily the most common clinical picture will be like one shoulder get involved, and after complete recovery of that shoulder only the next shoulder gets involved. But still there is cases with bilateral simultaneous, that means together, both the shoulders together. As you can imagine, that will be a very disabling condition for the patient. Yes. Both shoulder get affected and both shoulder get stiffness.
So in your observation, what are the most common causes of frozen shoulder?
So when we consider causes of frozen shoulder, there are two types of frozen shoulder. One is called primary or idiopathic frozen shoulder, in which there is no underlying cause. The pain and stiffness starts by itself. So there are a lot of theories try to explain why a patient suddenly develops a pain and stiffness in the shoulder. One theory is that it could be because of some small injuries to the muscles inside the shoulder joint that will provoke an inflammation and gradually causes fibrosis. Another theory that support immunological factors for the development of frozen shoulder. Anyhow, it is not proven yet. And secondary frozen shoulder is a second type. In secondary frozen shoulder, there is underlying causes. So it could be causes inside the shoulder itself. We call intrinsic factors. So intrinsic, that means inside the shoulder the causes are sometimes injury to the muscles inside shoulder joint, or inflammation of the muscles inside shoulder joint, or an arthritis or nearby joint like acromioclavicular joint and all. Or the factors could be extrinsic outside the shoulder joint. It can be because of a patient develop a stroke on the same side, or it could be because of herniated disc on the same side of the neck, which impedes the nerve supplying the shoulder joint. Other causes are like after a surgery or a radiation of the cancer in and around the shoulder, like cancer of the breast and all. Or it could be following an injury like fractures in and around the shoulder, like humerus fracture, clavicle fracture and all, for which for a patient have done immobilization for a very long time. So these all factors can be can cause frozen shoulder. Systemic factors are also there. Like one important systemic factor is diabetes. Diabetes patients have up to 20% of chance of getting frozen shoulder.
So they are at a higher risk of getting.
When you compare to general population, it is only 2 to 5%. And the severity of the frozen shoulder is also high in case of frozen shoulder, and they are very resistant to treatment as well, diabetics. Other systemic factors include thyroid disorders like hypo and hypothyroidism, Parkinsonism, other adrenal gland disorders. Many endocrine disorders can provoke development of frozen shoulder. So these are the basic causes for frozen shoulder.
So when patients with frozen shoulder come to you, what are the most common complaints that you hear, the most troublesome things that they encounter when they have frozen shoulder?
Frozen shoulder, essentially the essential features of frozen shoulder is always pain and stiffness, progressive stiffness of the shoulder joint. As I mentioned earlier, it is a self-limiting disorder in most of the cases. It will take around 2 or 3 years. So the clinical course is not constant, it varies, the intensity and all. So normally a patient goes through 3 distinct clinical stages. So first stage is called freezing stage, second stage is frozen stage, and third stage is called thawing stage. So in the freezing stage is the initial stage in which there is intense inflammation inside the shoulder joint. So this is stage at which patient feels maximum pain. So patient will feel pain, gradually developing pain on the shoulder. Stiffness also starts in this stage, but it's not very prominent in this stage. So patient will have more pain when he is sleeping. His sleep will be disturbed. He cannot lift his shoulder only because of pain, not because of stiffness, only because of pain. So this stage usually lasts for around 2 to 9 months. Individual variation happens. And once the patient enters the next stage, that's a frozen stage, it's a stage of fibrosis. Patients start feeling that the pain is reducing, but the stiffness goes on increasing. So in this stage, patient feel intense stiffness. The range of movement of the shoulder is so reduced that even normal routine activities also will be limited.
But the pain would be less.
Yeah, pain would be less in the second stage.
Stiffness would be more.
Stiffness will be more. Patient will have problem with the like routine activities like hygiene,
even lifting a glass,
combing hair, dressing, everything will be difficult for the patient, especially if it involves the dominant side, as you can imagine. And the next stage is thawing stage. Thawing stage is the stage of recovery. So in this stage, what is happening is pain and stiffness gradually wean off. Patient recovers. So this is the normal clinical scenario that we see, but it's not 100%. Like some patients can continue to have stiffness, residual stiffness for many more years. So this also can happen. So we are not 100% confident that within 3 years patient will be normal. That we are not 100%
So it depends from person to person.
person.
In most cases, maximum is 3 years.
3 years.
But in some cases, it can linger on for a longer period of time. So how do you investigate? How do you know that? You spoke about X-ray, but I believe X-ray only gives a small peek into what is happening. So what are the other means that you use to investigate frozen shoulder?
Actually, diagnosing frozen shoulder is very easy. It doesn't require any sophisticated investigation. When a patient comes with a typical history and we elicit typical clinical findings, we are almost confident that this patient is having frozen shoulder. And the importance of investigation is to rule out other conditions that can present same as frozen shoulder. For example, we order an X-ray. It's a basic investigation imaging technique that you can order. And with an X-ray itself, we can rule out many things. Like for example, a patient developing an arthritis of shoulder joint, that patient also comes with a progressive
almost
stiffness, pain and stiffness of the shoulder joint. Other things are calcific tendinitis. It's basically
so the X-ray rules out
other things, other disease conditions that can mimic as that of frozen shoulder. And other investigations like ultrasound, MRI, all we do to rule out other coexisting conditions like muscle injuries, labral injuries, etc. So that thing we can rule out with the help of other investigations. And also there are specific signs that of frozen shoulder that we can get with ultrasound and MRI. There are specific features that we can get with these investigations as well. So investigations are basically to rule out other conditions and to rule out other coexisting conditions.
So, I am sure our viewers would like to know how is this managed once you have been diagnosed with frozen shoulder, what are the treatment options available?
Actually, there are a lot of treatment options available for frozen shoulder. We generally consider the stage of the disease, that means whether the patient comes in freezing, frozen or thawing stage, and also we have to consider many patient characteristics like a patient's age, bone quality, his occupation, his whether the condition is secondary or primary frozen shoulder, other comorbidities like diabetes, and also we have to consider patient's goals. What is his expectation from our treatment? That also has to be considered, because some patients require a faster recovery, some patients are okay with slower, but it doesn't want any sophisticated techniques and all. So that all depends. And a key factor of treatment of frozen shoulder is patient education. We have to make patient aware about the condition that he is having and the normal course of the disease that we are expecting, and we can reassure the patient that in most of the cases we are expecting a recovery in 2 to 3 years time. So that will reduce the frustration of the patient also.
They know what to
they
expect.
Know what to expect.
It's going to take some
yeah.
time.
And by explaining everything, patient can actively participate in choosing the suitable treatment for him. So generally we start treatment conservatively, that means non-surgically, that include a pain relieving treatment and physiotherapy. For pain relief we have medications, but you know that give a very short duration of action and not good.
It has its own side effects also.
And all.
Yes.
Another type of pain relieving treatment is injection into the joint. There are two things, steroids and hyaluronic acid. Hyaluronic acid is basically a supplement of our normal synovial fluid. So both the steroid and hyaluronic acid give almost similar effect, but hyaluronic acid having very less side effect. So we prefer hyaluronic acid over steroid for pain relief.
And at which stage is this recommended, like the freezing stage?
It's a good question. Yeah, because pain will be intense in the case of in freezing stage only. So mostly we have to go for injections mostly in the freezing stage or early frozen stage only. Afterwards there is no role for pain relieving modalities. But physiotherapy is the main treatment for frozen shoulder, and it's a very simple treatment also. Physiotherapy depends upon the stage of the disease, and physiotherapy should be uninterrupted supervised. That means it should be done by a physiotherapist. We cannot directly send the patient home for home therapy, home exercise and all. We have to start with physiotherapy.
It can have a harmful effect, I
Yeah,
suppose,
correct.
if you
And
do it
patient
at
cannot
home.
do also.
It will be too painful for them.
Too painful for him. There are specific machines designed for this exercises and all. So therapy protocol also depends upon the stage of the disease. In freezing stage, as the patient having more pain, we cannot start on aggressive stretching. So we start with gentle stretching and pain relieving modalities. And in the second stage only, we will start aggressive stretching, and we include more of strengthening exercise also. Like so, physiotherapy treatment also depends upon the stage of the disease. So this kind of treatment, like the medication plus physiotherapy, usually is very effective. Like up to 90% of cases usually respond well to this kind of treatment. So the other type of patients, like those who didn't get much response with the physiotherapy, or those patients who want a faster recovery, because this physiotherapy and medication, this kind of treatment require many months to respond. So those who want faster recovery, they have to go for more aggressive treatment methods.
So doctor, you spoke about some patients not getting enough relief from physiotherapy and the injections and all that. So what are the other higher mode of treatment options available for them?
Yeah, there are some higher treatments available that are non-surgical also. One higher mode of treatment is manipulation under anesthesia. So in this technique, what we are doing is patient will be under general anesthesia, and we forcefully manipulate shoulder joint in all directions to break all the contracted capsule ligaments inside the shoulder joint. So during this procedure itself, we will get complete range of movement, and this regained movement we will maintain with the help of physiotherapy afterwards. So under safer hands, it is under expert hands, it is a safe procedure only.
And done under general anesthesia, so
it
the
should be
patient
done
would
under
not feel any pain
at all. Only thing, the patient has to be under general anesthesia. Another type of treatment we call intra-articular saline hydrodilatation. It is basically a minimally invasive technique in which we inject a high volume of saline, normal saline, mixed with steroid and local anesthesia. So this will expand the capsule of the joint, and this will increase the mobility of the joint afterwards. So these are the two non-surgical method, higher mode of treatment for frozen shoulder.
So is surgery also an option as a last resort? Do you actually operate on frozen shoulder?
Correct. There are a lot of surgical methods available. Previously we used to do open surgical method, but nowadays nobody do open surgical method. It's very rarely done. Most commonly done surgical method nowadays is arthroscopic. We call arthroscopic capsular release. It is basically a keyhole technique in which we have to make small incisions, small openings in the front of the shoulder and back side of the shoulder. And through one hole we put the camera inside, and through the other hole we will put a radio frequency ablator. And by looking into the tissues that is involved, we can release the ligaments and capsules. So this technique is very precise and controlled technique, and even we can do this with patient awake also, because we can do under nerve block. We can inject a anesthetic into the neck, and patient can see this procedure, so that himself can see that the range of movement is increased during the procedure. That will boost the patient confidence to adhere to the future physiotherapy protocols and all. So this is the most advanced technique for a frozen shoulder, arthroscopic release. Yeah.
So doctor, before we wrap up, any takeaway message for our viewers?
My advice to the viewers, those currently having pain and stiffness of the shoulder joint, don't wait too long, get medical attention as early as possible, because early recognition, early starting of treatment usually gives a better result. And to those who are currently having frozen shoulder and on physiotherapy treatment, please stick on to the treatment, because physiotherapy have a very high success rate. The other type of patients, like who did many sessions of physiotherapy not getting much response, or those who want a faster recovery, do not hesitate to go for a higher mode of treatment, because in modern technology is so advanced that it gives very less side effects with very high effect, very high functional effect. And in our center, actually there are many doctors, like we have a group of doctors who are well trained even for the surgical methods. And we have all the physiotherapy, all these branches have physiotherapy, well equipped physiotherapy units. And for imaging, we have a very high quality MRI scan in Hilal Muharrak branch. And as you know, we are always affordable, available, accessible all around Bahrain. You know, in this small country itself, there are 5 branches currently, and more branches are coming up. So in fact, we are in every corners.
Yes, and the patient, I'm sure, will be in safe hands, and it's also very reassuring to know that it's something, it can be treated. Maybe it may take a while, but definitely the patient can come out of it with the right kind of treatment and physiotherapy and all that. So good to know that, doctor. Thank you so much for joining us today and for explaining to us in detail about frozen shoulder. Appreciate you taking the time out to be with us today.
Thank you.
Thank
you for
you
this
so much.
opportunity. Thank you.
So friends, if you experience any symptoms of frozen shoulder, please don't delay. Please seek medical assistance at the earliest. As Dr. Imith rightly mentioned, this is something which can be treated and cured. Timely medical intervention, physiotherapy, a good lifestyle will all help you in keeping frozen shoulder at bay. So for more informative and valuable episodes like this, don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Till we meet again next time, this is Anupama signing off. Good night, stay healthy and stay safe.